Further debates? I recognize the member for Nickel Belt.
Thank you so much, Speaker, and thank you to the member for her presentation. The motion that she has brought forward, I want to read into the record that, in the opinion of this House, the Ministry of Education should call upon Ontario school boards to implement a comprehensive epilepsy strategy which includes training of teachers and staff on the administration of emergency epilepsy medication to students having an epileptic seizure, promoting a safe and healthy learning environment. I can assure you that the NDP will be voting in favor of this motion, and we will be working really hard to make sure that this motion becomes reality. The sooner, the better. I have been in this House for 16 years. I was here in 2015 when the then Executive Director of Epilepsy Ontario, Paul Raymond, came to Queen's Park. You know what was the #1 ask of Epilepsy Ontario back on October 27, 2015 when they came to Queen's Park? I'll read it to you. Protection for students with epilepsy in Ontario school. Epilepsy Ontario would like to continue our work with the Ministry of Education and Health and our community partner to ensure that students with epilepsy are safe while at school and have the opportunity to be part of Ontario education success story. Unfortunately, none of that happened. But I am hopeful that today things will change for the better. We have over 100,000 people in Ontario right here, right now, who live with epilepsy. For 30% of them, they do not have an effective seizure control. While recurrent seizures are the most obvious effect of uncontrolled epilepsy, epilepsy can impact all parts of a person's life, including their family, including their education, including their employment, including their mental health. It is also associated with other conditions. We have, as legislators in this House, the opportunity to change all of this. The care that a person needs if they happen to have a seizure is something that all of us can learn to do. There are 14 agencies that exist in Ontario that do just that. They offer people training. They offer training to school boards, to schools, to any type of agencies, to workplaces, to where people gather, to gyms, to anywhere. Those agencies have not seen a stable funding from this government since they were elected. They used to get a little bit of money from the provincial government so that they could make that training available to any group who requested it. They were very active in my area of the province. I represent the riding of Nickel Belt, which is a big northern riding in northeastern Ontario. And we had an epilepsy group who was quite active. They went to our different school. They went to seniors group. They went to the 4-H and the all sorts of group to teach. And once you've taken the teaching and once you know a little bit more about epilepsy, it makes for a better community. Unfortunately, Speaker, there's still a lot of stigmatism against people that have epilepsy. A lot of people don't know. If they see somebody having a seizure, they will get scared and run away, not because they're bad people, just because they don't know what to do. We can change all of that. with the motion that the member brings forward, we can make sure that everybody who works within our school is ready and able to help every single child who may need their help. I would add that the bus drivers should also know. I would add that anybody that comes in contact with children, whether they work in a daycare or they work in a playground or offer swimming lessons or whatever else, that training should be available to them. That means that this government has to fund not only our school boards to be able to get that training, but fund those 14 agencies that exist right here, right now in Ontario, that have the knowledge, that are asking this government for really little bit of money so that they can teach all of us, so that we can, as we all learn a little bit more about epilepsy, we realize that they are people like you and I. They are people who, yes, they have an issue, but that doesn't define them. It just means that we need to know and we need to be ready to help them when they find themselves in times of needs. The rest of the time, they are human beings that want to be loved and want to be part of our community and want to be active and want to be part of our lives, just like everybody else. So I don't know if I'm assuming our visitors all know Dr. Cartner-Steele. He's the staff neurologist at the Hospital for Sick Children right here in Toronto. He wrote to the Minister of Health, and he talks about basically says physicians do not have the capacity to deliver the 60 to 90-minute education session after diagnosis, and the information is most appropriately delivered in the community. However, unlike other chronic diseases, community-based education and support programs have not been integrated into Ontario healthcare system. Across Ontario, 14 community epilepsy agencies do the same work as many health charities that receive government funding, providing this key information to patients, to their family, to the community about how to manage the disease, recognize when a situation is, what situation is and is not an emergency, and how to respond appropriately. Larger agencies provide support group and first-line mental health assistance through counseling and group programs. These agencies are in a constant precarious financial situation, relying on charitable fundraising effort and short-term grant. Even prior to the COVID-19 pandemic, these agencies were chronically under-resourced and in many parts of the province do not have a local agency serving their community. The economic and social impacts continue to constrain their ability to fundraise. Many agencies have been forced to lay off staff, just as other reports an increased demand for their services. There is a very real risk that services could be lost in many parts of the province. And he goes on to advocate for this government to do the right thing, fund those agencies that know how to offer the programs, the teaching that we want happen into our school is not just going to happen out of the sky. There are epilepsy agencies right here, right now in Ontario that have the knowledge, that have the skills, that are more than willing to go into each and every one of our schools where there's a child at risk and do the training. Do the training to the sport teams, to the people who drive the buses, do the trainings to everyone, because we can all learn. We can all help. But this will only happen if this government answer the request for that little wee bit of funding that will change the lives of thousands of children who have epilepsy and thousands more who live with it for the rest of their lives. I will add to this that there are new effective seizure controls treatment that exist. Some of them are available in other provinces, but are not available in Ontario. Why not make those treatments available to all? If you have a disease such as epilepsy, if you are still facing seizures and there are treatments available, those treatments should be available to the people of Ontario, like they are available to the people of Alberta, where the government decided to fund those services and those therapy. Why is it that this government is not willing to help? And then they also ask to ensure funding for a strategy rolled out so that we make sure that the government has in the past said that they wanted a strategy to deal with epilepsy. They have said that they would put a certain amount of money toward that strategy. None of that has taken place. We don't have a work group working on that strategy. We don't have money to support any of that. So I thank the member for bringing this forward. This is something that I hope all of us vote in favor of. We can help children have normal lives. We can help children make sure that they go on school trips just like all of us wanted to go when we were kids, and just like our kids and grandkids want to do. They want to be part of the fun that happens within our education system. I know that school trips also serve a role in teaching and education, but they can be a lot of fun too. They can be an opportunity to create new friendships and discover new things. All of this must be available to every child, and that means children who have epilepsy. And that will happen when this government fund agencies that do the teaching and make sure that every school boards get that teaching. Thank you, Speaker.